Well, joining me now is Dr. Basha Mukherjee. Thank you very much indeed for coming into the studio on a Sunday morning. I guess that's the question. Is this justified?
I think this is something that needs to be addressed, that we've been having this for a whole year now. It started before March. I mean, the strike started in March, but the conversation started much before that. And it's really sad that this is still ongoing. It's not just about the money. I know this is what the media keeps sort of highlighting. This is just about getting a pay raise.
To be fair, the BMA keeps highlighting it too.
Well, we need to try and focus on the retention of staff. We have lost 20,000 doctors in 1 year alone between 2022 and 2023. And that has cost the NHS about £2 billion to just replace that. It's cost the NHS £3 billion now to cover for all these shifts that we've been striking for, essentially. So it just doesn't make sense. The numbers just doesn't make sense. If you're saying, the government is saying that they don't have enough money to pay doctors fairly, then where is the money coming from to replace all of these staff members? It's cost them triple the amount than what it would have been to just pay doctors fairly.
Well, I'm sure those figures can be disputed, but I take your point that this is costly, extremely costly, to retain doctors and to rehire and to retrain and so on. But this is the 11th walkout now since March 2023, last year. Has there been any positive impact?
I feel like there has been very slow progress, and the slowness of this, I feel like, have to blame the government for this.
They've done a very good job. The 11th walkout and there's no big pay rise.
Exactly. And why are we still here? Why are we still putting lives at risk, essentially, which is what the government is claiming, that it's purely because of that's what Rishi Sunak is essentially saying, it's purely because of the junior doctor strike, which, let me tell you, is not true. There's only been a 3% increase. There's been only a 3% increase on the waiting list due to the junior doctor strike, and the waiting lists were going up way before the junior doctor strike even started.
Well, as I said in my introduction, potentially 100,000 patients go without their appointments, go without their checkups, go without their operations. I mean, really, can you rest easy knowing that on your conscience?
And that is even more reason for the public to be aware of these strikes, and including, you know, the politicians. This is very strategically timed, and we've given notice as well. The strikes can stop even before that if the government come back to talk about this and rediscuss, essentially.
I mean, I think for most people, well, for some people, this will look like potentially trying to impact the election results. Trying to intervene in that. So I imagine that many BMA members would prefer a Labour government. I think that's fair to say. You know, you often see the socialist workers out. There's lots of people who are of left-wing orientation at the BMA. So is this trying to put the pressure on so that the Tories look like they can't manage the NHS?
Well, the Tories haven't been managing the NHS very well at all for the last 14 years. And it's so ironic that that's the exact time frame by which we have had the regression of payment, essentially. So if you look at it, the correlation definitely stands for that the Tories have failed. However, I'm not sure if I'm fully in favour of everything the Labour government is bringing forth either. However, West Streeting has said that there is potential for the wages to be increased over a period of time, which is exactly what the BMA is asking for.
Well, the BMA were asking for 35% straight up. It seems like they've actually watered down that ask. Wes Streeting, though, he's said he's not going to have an easy time with the BMA either. He said the BMA are extremely hostile towards him in the past, or at least hostile, because he wants to make changes. These 40,000 appointments that he's going to bring in, apparently, so he says, that's going to be done through overtime. Are there doctors who want to work overtime?
Well, this is exactly, I've had this conversation with West Streeting myself. The idea is actually to reach out to the private areas of the healthcare system to fill for these gaps, essentially. And what the Labour government is trying to do is essentially pay more to cover those costs. I don't think that's a very good strategy. I do think that the majority of NHS staff are already burnt out, and it's not going to be cost-effective what they're estimating how much it's going to cost to fill those shifts. I don't think that's an accurate estimation at all. He's not taking into account that he'd need to pay the staff fairly for their in-hours to be able to, incentivise them to do the out-of-hours shifts. But, I'm not going to go into the numbers. I'm sure they've had quite very, educated people go in to look at the numbers.
Do you have friends who are, working part-time in the NHS and picking up work elsewhere? Because this is one of the problems. It used to be that doctors would work full-time. And now more and more people seem to be going part-time, which makes it more expensive to cover. That's why you have to bring in the agency workers. That's why you have to bring in people on overtime, etc., etc. What do we do about that? How do we make it an actual 7-day-a-week service?
Pay them fairly. You know what? There's been a decrease in the number of people who are striking because simply people cannot afford to. I myself am not going to be striking. I've only striked for 5 whole days in the 39 days that they've had off strike so far. However, that means that the people are getting burnt out who are currently at work. They're going off sick leave. A lot of them are sick or on part-time. They are, people will find a way to manage with the burnout if they're going off sick, if they're going off on part-time, or they're leaving the country. This is what we're finding in the numbers. This is a lot of stress.
Do you think that maybe they'd be happier if the NHS was different, a different system, like in Australia or like in continental Europe? Elsewhere, things seem to function a little better. Doctors end up earning actually more than they do here. The NHS perhaps is the thing that's holding you all back.
The NHS has great positives, but we have to be reform positive about this whole situation. Ultimately, we've seen a massive change in the demographic of our population. Our population now, there's a huge emigration burden. It's increased by a million people in the last 1 year alone. That adds a lot of pressure on all the services across the NHS, secondary care, primary care, pharmacies everywhere. We've got drug shortages as a result of,
That's an argument to bring immigration down.
That's right. Absolutely.
You wouldn't see many BMA protesters, activists and junior doctors probably arguing to bring down immigration, would you?
Well, there's absolutely a reason to bring immigration down because ultimately you were talking about this just earlier about watering down the pay essentially because you can hire somebody from another country for less essentially, so that keeps the wages low. So absolutely there is a argument to keep the immigration low.
Well, very nice to speak to you, Dr. Basha Mukherjee. I would say good luck with the strike, but I don't wish to wish you good luck, but I wish you well.
I'm not striking.
I wish you well. You're not striking, so there you go. Thank you for coming in.
Thank you.
Now, after the break, is Labour's proposed tax raid on private schools already backfiring? I'll speak to the spokesperson for Education and Not Taxation campaign.